So next speaker will be Dr. Khokhar. He will be talking on topogra topo-guided treatment with MEL 90.
Yeah. Okay. So thank you very much, sir. So why did I start this topic? Because whenever you go, patient comes to you in the clinic, the first thing they say after you work up is, "Sir, can you do Contura for me?" So then I went to the media and realized people are putting videos saying Contura is the latest. Can I have my videos? Can I have my slides, please? I'm not Sundaramurthy.
Yeah.
Yeah. I'm Sundar, but I'm not a Murthy. So, so it came to my mind, well, is something new? Then we went into the literature and realized it's not a new thing. And fortunately, at RP Center, we had both the machine. We had an EX500, which some people also called Contura machine. I don't know why, because it's just don't do Contura. It does all those things. Wavefront guided and optimized, everything can be done. So Contura is basically a topo guided refractive excimer procedure using EX500, which is Elcon product. So that's the only machine which does it. The answer is no, because if you see Carl Zeiss, they came with a model MEL 90, which was about 5 years back, and they had this system called Tosca, which had the topo guided, but somehow their machine or their guys could not manage to put it across to the people. So I've started again. I used MEL 90, which has the same system. But if you had started that earlier, so all those people must be whispering my ear, "Can you give me Tosca?" So it's your fault. So you can still get back onto the bandwagon and make it. Because topo guided, I'll just tell you what it is exactly as compared to the wavefront optimized and guided. This is for the basic teaching. But and the other, if you have a Johnson machine, you can have iDesign, which works the same way, and the OBD Cat or Nidex. So if you have any of these machines, you can still do a topo guided without trying to switch over your machine just because you want to have a Contura. It's something like you're going to buy a toothpaste. You can have a Binaka, Colgate, or whatever suits you, and you can even have the Patanjali thing if the Indian Make in India comes in. It's one thing you're buying, so that doesn't mean the other things are not equally good or bad. So that's what is my talk all about. And I think the Carl Zeiss machine is good, no financial interest. The best thing is that if you cut a flap, femto flap, I cut 80 flaps for the last 3 years, which none of the machine can do it, which we tried on FS200 of Alcon. After 100 micron, it gives you the bubble breakout. So 90 micron, when you try, 10 to 20% patient might have a bubble breakout with a black. You have to abandon the surgery. In this one, we're doing for the last 3 years. We've done about more than 500 eyes now without even a breakthrough with the 80 micron, and it's worked wonderfully well. But that's not what I'm talking about. I'm going to talk basically about what we are doing to ablate. So you raise the flap and you ablate the cornea. So when you ablate the cornea, you need excimer. So what is wavefront optimized? We all know that it does not correct the pre-existing higher order abrasions. So if it's there, it'll give you vision 6/6 again, but the abrasions, if they're there pre-op, will continue to progress. It'll stay like that. Whereas if you do a wavefront guided thing in which you can correct the pre-existing also. So it takes the pre-existing data, that means it takes the abrometry and puts them together and take it. When you do a topo guided, it basically take your refraction as well as the topo guided data which corrects. So it will actually take care of the abnormal corneas in much better way. So can we use it for the virgin corneas? The answer is, if you see the studies, you realize that there are lots of paper we are coming up for the last 3 years in which they use it in the virgin corneas also. And the RMS need not be very high to go for the topo guided. You can still get a good result in a virgin corneas also. So this is what the Contura was approved by FDA in 2016 for the virgin corneas also. Earlier, they used to all go for abnormal corneas in which there was a more RMS or there's a irregularity of the cornea. So similarly, there's one study with MEL 90 which was published again, in which they used this one for the virgin cornea. So with that in mind, we did a study at the RP Center. We did about 200 eyes on both the machines, and we realized that both the patients at the end of 6 months and 1 year were absolutely the same, no problems. So why should one machine be preferred? It's your choice to pick it up. There's some few shortcomings with the machines, both the machines. I'll just step on that and touch about that. So what we did, we take the data. The problem with the Contura, capturing of the data is very difficult. If you take 100 patients, maybe 55 to 60% of the patients, you can actually use the data which you can translate into the refractive surgery. Majority of them, you can't do it. Anybody has experience with the Algarato wavelight? Okay, so can you capture 100% patient? Never ever possible. I was in Australia, they were talking to me, why don't you switch over 100%? As if you can do it for my patient, I can do it. We put expanders, put all the funny things, looking up, looking down. You still can't get all the images because you're machine dependent. Whereas if you're putting yourself on the Atlas platform, the platform which we use for the Zeiss platform, you have a choice to actually go ahead and use your refractive refraction also, and mix and match, and you can get the result. So this is what the atlas looks like. The basic thing, the 7th and 8th rings are the most important. The distance between the 8th and the ring are equal. So once you get this data which shows this one, you're good to go. You don't have to go any further than that. So I think this is a much superior and a better system to work on. So this is what it looks like, and the 4 images you can capture, and you can pick out the best. If all 4 are similar, which in 99 to 100%, if at the end of 1 week we could do. For the beginners, you might get 80 to 90%, which still is a very good yield as compared to any other machine which is available right now. So the non-acceptables, you can see gross ones. Of course, there's a dryness on the eye, or the meibomian discharge. Of course, you're not going to do in this one. So blink the eye, put a refresh tear on the surface, come back again 10 minutes, and you can pick up the data. Okay, so topography and topo smooth is another thing we can add on, in which you can actually add on the map without refraction input and one with the refractive input. So once you think your data is not complete, it has little lags, you can actually add on the refraction to that, and your results actually matches. The final results are the same. Okay. So we did about 160 eyes with the EX500 and other with the MEL 90, and there was, of course, no contraindication surgery. All the pickup criteria were similar for both the things. I'm not going there. So what we realized that both eyes are equally good, and after 1 month and 6 months, this is the data. This is the pre-op pentacam of the patient. That's a 1 month and 6 months, and again pre-op 1 month and 6 months, and we realized that the hyoid abrasions, which also I think were much less in patients with MEL 90 as compared to the Contura. We're sending it for publication. Okay. Now this is one of the procedure on machine EX500. And this is what a wavefront optimized elastic is. You go there, lift up the flap. So what I want to say, there's no difference in the delivery. It's just the mode of delivery of the examiner. Rest all procedures are the same. So just charging a little extra, 10,000, 20,000 people are charging extra for just one step. I don't think that's justified. Anyway, it's their choice. Now, if you notice, all the ablation is right in the middle here, and it doesn't go to the periphery. Whereas when you're doing for a Contura, you need to have it actually fires a little more. It covers bigger area, covers from the periphery. That's what the Contour is all about, and it comes in the center. So this is what is the basic difference. And if you do it on the machine, which I am talking about, MEL 90, and that's what it looks like. And this is the 80 micron flap. The only problem with the Zeiss machine is that when you're going on the topo mode, it gives you a frequency of half the frequency. So your time goes up. So this is a -6 diopter. Took me 24 seconds. So you have to talk to the patient. The good thing is that this machine has a pupillary capture, and it's eye registered. So if eye goes off the center, it'll stop firing. But still, there are chances that you can get some vertical comas if the eye moves upward. If that can be modified, I think your machine will be much better than any other. So that's the only drawback which we have. Otherwise, the results are absolutely fine. And we followed it for 1 year now, 6 months data I showed you. And this is what you see the firing going on. It's actually 21st-second firing, so I didn't edit it. So this is what it takes, and it takes time. Whereas the other machine is a little faster. Whereas the other wavefront customized modes are all 500 hertz. This one is the only which is firing at 250. I think if you guys can look into it, it'll be a big help for us. So coming at the final slide. So the capturing is very good in MEL 90, whereas in the EX500, it's not as good. 4-scan, you can do it much faster. There you need more scans, and the chances of reproducibility is very low. No objective criteria to assess the quality of the scan here, whereas there the machine actually picks up, which is a good thing and a bad thing both, because then you can't decide what you want to do. So no guideline to proceed for topo, which actually has to be written. We have to do more surgeries and come up with our own guidelines. Planning is much simpler. The only speed is low. Otherwise, the results at the end of the 1 year, all my patients are absolutely the same, no problems. In fact, hyoid abrasions were less in this group as compared to other. And thank you.
Thank you very much.
Thank you, sir. It was an excellent talk. I do agree with that. I do have got a MEL 80 system, the previous version. Still, it does a very good topo-guided treatment. Only, yeah, it's very good. Only thing is that they are not marketed. Apart from that, is excellent. करने क्या है सर?
कर लो 5 मिनट का टाइम है
5 मिनट नहीं 10 मिनट होता है.
हाँ 10 मिनट दे देंगे.
No.
So
So discussion.
I agree with you. This Zeiss platform is very good. I've been using the MEL 80 and 90 platform since 2012, and these two color system CRS master works wonderfully. But the only problem is when the patient comes to OPD, they are saying, no, we want the Contour, not a system like this. What do you say to those patients? How do you convince them?
That is the media thing now. You ask them what exactly is Contura, they won't know anything, because most of these people will not understand. Either they're too rich, they have too much money, they won't bother, or they're too poor, or they're applying for a job or something. and it's the media driven thing. So it's I think we'll have to get into that, because how can the media buy? So like if you want to buy something, there's so many ads coming, right? But you pick up the thing because you're wiser. So it's an ignorance for those people.
Agree, sir. But they want that this is not, are you on the only Contura, not a thing like Contura. So that's where,
So
you know,
what
it's
you can
slight
do is you
ignorance.
can buy a second-hand machine which even doesn't work. You put a EX500, put it up
So
there.
that's what I've done, sir. I have two machines at my clinic. One is EX and one is the Zeiss MEL 90. That
Exactly.
is what I have done.
And you're using MEL 90. This one is for the show.
I'm using MEL 90.
No,
more.
I think that's right, because in Delhi also I've gone to 2-3 places. They are actually pulling their hair out saying that we have to buy it. So what they're doing is they're procuring the second-hand machines from somewhere and
That's
just
what I did.
just parking it there.
Yep.
Because you can't run, you can't afford, because RP Center we have enough money to burn, so we have both the machines running.
Yeah, even I am putting the topolizer to show them, because many of the times they come, they show me the picture. This is the Contura machine treatment planning, or show me that. So I'm just showing them topolizer, just lying there, just lying over
I'll
there.
tell you one thing, because the Contura guys who are operating, there were certain guys who got their wavefront, this thing capturing machine had gone bad for 2 years. It was out for repair,
I know.
and they were
sir.
still doing
Yes.
Contura without capturing. So well,
Yes.
that's it. It's all here.
And so regarding the smile, I think the most crucial thing which I have faced in my practice is you have to, you know, iron the Bowman membrane for the wow factor for the next day. I don't know. I would like to have your
See,
inputs for
my
that.
smile patients, even 500, the next day is 6.5 or 6.6. What are the vision? I don't have 6.9 visions. I don't know. That
Yeah.
can happen only once. It's a new machine to a new environment.
Exactly. Energy
See,
is not
each
set.
machine has to be fixed in that room with the humidity, the temperature, and what altitude from the ground you are. If you're at Mount Abu or you stay in Mumbai, it's going to make a difference. When we started doing smiles about 5 years back in RP Center, we had put the energy level at about 35, 36, and we were happy with getting cut. But when we realized the vision was 6.9, and gradually we reduced down to 27, 29, 28. Now we are good, and lenticules are perfect.
We are also on 28 and it's working very
Exactly.
well.
27, 20 is the way to go, depending on what. So initially, I think even the guys who were coming to assist, they didn't know much about that. Gradually, we realized that. But now the wow factor is same.
Correct.
And the other things, all the interface related problems, like how many people come across fibers going under the LASIK? Why? Because the AC duct or the what coat suits you wear. So the problem of that also is reduced minimally with smile, because that's one of my indication for
Also,
people.
do you watch the interface in the smile?
Never.
anywhere?
I never.
You don't.
I don't watch the interface at all. There's no need
So
actually.
then there are some remnants of the bubble which are left on the next day.
Doesn't make bubbles are healthy. They'll go away. The way they came, it's goes away.
Yeah.
You know, you get some.
If
of
you
the
have a foreign
debris.
body, then there's a problem. If you have a foreign body, of course I'll go and pick it up.
Mohak,
Yeah.
And even washing the foreign body alone is not going to work, because it'll dislodge inside only. So you have to go hold it and pull it out.
All right. So we